Imagine being in the middle of a sentence, and suddenly, the words stop making sense. Your mouth moves, but nothing comes out the way you intend. Your arm feels heavy, your face feels different, your body isn't responding the way it should. And in that moment, you don't fully understand what's happening, but your brain does. Because it's losing something it cannot survive without: blood. This is a stroke. A condition where the brain is suddenly deprived of oxygen and nutrients. And when that happens, brain cells begin to die. Not slowly, but within minutes. In this video, we'll explore what a stroke really is, what happens inside the brain, the different types, the warning signs, treatment options, prevention, and how families can respond when every second matters. What is a stroke? Let's start with something important. A stroke is not just a medical event. It's a sudden interruption in the brain's blood supply. The brain depends on a constant flow of oxygen-rich blood to function. Every thought, movement, and memory depends on that supply. When blood flow is blocked or a vessel ruptures, the brain is cut off from oxygen. And without oxygen, brain cells begin to suffer damage within minutes. If the interruption continues, those cells begin to die. This is why stroke is considered a medical emergency. Because the longer the brain goes without blood, the greater the damage. And unlike other parts of the body, the brain cannot easily repair itself. Pathophysiology. What happens inside the brain? So what's actually happening during a stroke? Under normal conditions, blood vessels deliver oxygen and nutrients to brain tissue. Neurons use that oxygen to generate energy. Signals are transmitted constantly throughout the brain. During a stroke, this system is disrupted. There are two main ways this happens. A blood vessel becomes blocked. A blood vessel ruptures. In both cases, the result is the same. Oxygen supply is reduced or stopped. Brain cells lose energy. Cellular processes begin to fail. Within minutes, neurons stop functioning properly. Electrical activity becomes abnormal. Brain tissue begins to die. Surrounding the most severely affected area, there is a region called the penumbra. This is brain tissue that is damaged but still potentially salvageable. And this is where treatment matters most. Because if blood flow is restored quickly, some of that tissue can recover. If not, the damage becomes permanent. Types of stroke. Not all strokes are the same. Understanding the different types helps explain symptoms and treatment. Ischemic stroke accounts for about 85% of all strokes, caused by a blockage in a blood vessel. This blockage may be due to a clot forming in the brain, thrombosis, a clot traveling from another part of the body, embolism. Risk factors include high blood pressure, high cholesterol, atrial fibrillation, hemorrhagic stroke, caused by a ruptured blood vessel. Leads to bleeding in or around the brain. Common causes include uncontrolled high blood pressure, aneurysms, weak blood vessel walls. This type often develops suddenly and can increase pressure inside the skull. Transient ischemic attack, TIA. Often called a mini-stroke, temporary blockage of blood flow. Symptoms may last minutes to hours, but they are a serious warning sign. Many people who experience a TIA have a higher risk of a major stroke in the near future. Signs and symptoms. Stroke symptoms appear suddenly, and recognizing them early can save a life. The most common way to remember them is fast, face drooping. One side of the face may appear uneven or numb. Arm weakness. One arm may drift downward or feel weak. Speech difficulty. Speech may be slurred, confused, or impossible. Time to call emergency services. Immediate action is critical. Other symptoms include sudden numbness or weakness in the face, arm, or leg, confusion or difficulty understanding speech, trouble seeing in one or both eyes, difficulty walking or loss of balance, severe headache with no known cause. The key detail: These symptoms begin suddenly, not gradually. Why time matters. There's a phrase used in stroke care: time is brain. Every minute a stroke goes untreated, millions of brain cells are lost. This is why early treatment is critical. Quick action can restore blood flow, limit brain damage, improve survival and recovery. Delays can result in permanent disability, loss of independence, increased risk of complications. Treatment, medicinal. Treatment depends on the type of stroke. Ischemic stroke treatment. The goal is to restore blood flow. This may include TPA, tissue plasminogen activator, a clot-dissolving medication that must be given within a specific time window. Mechanical thrombectomy, a procedure to physically remove the clot from the vessel. Hemorrhagic stroke treatment. The goal is to control bleeding and reduce pressure. This may include blood pressure management, surgery to repair the vessel, draining excess blood, treatment, non-medicinal. Recovery is a long-term process. It often involves rehabilitation. This may include physical therapy to restore movement, speech therapy to improve communication, occupational therapy to regain daily skills. The brain has some ability to adapt, a process known as neuroplasticity. With time and therapy, new pathways can form. Prevention. What can we do? The most important fact about stroke is that many cases are preventable. Up to 80% of strokes are linked to modifiable risk factors. Key prevention strategies include controlling blood pressure, managing cholesterol levels, treating diabetes, avoiding smoking, maintaining a healthy weight, staying physically active, limiting alcohol intake. These actions don't eliminate risk completely, but they significantly reduce it. How families can help. Family plays a critical role, both during and after a stroke. Immediate response. Recognize symptoms quickly. Call emergency services immediately. During recovery, support rehabilitation efforts. Encourage consistency in therapy. Help maintain a safe environment. Emotionally, be patient, offer reassurance. Understand that recovery takes time. Stroke. Recovery is not just physical, it's emotional and psychological as well. Conclusion. A stroke happens suddenly, without warning, but understanding it changes how we respond. Because early recognition saves brain cells and saves lives. The difference between recovery and permanent damage can be minutes. If you found this video helpful, share it. Because knowing what to look for and what to do can make all the difference.